Sometimes, when all hope seems lost, one decision can make all the difference. This is the story of Ghanshyam, a 59-year-old man who faced the ultimate test of survival.
Frankly speaking, I was at that point of time not very convinced because I thought that we are going to lose him on table.
We always feel that if we lose him, how will we be able to face the family, even if we have not done anything wrong?
He presented in a very, very bad condition with ejection fraction of around 10%.
He was lucky enough to survive in the flight from Canada to our institute.
2-3 डगला भी चल नहीं सकता था, 2-3 स्टेप। मेरे को पेशाब झाड़ा ऑटोमेटिक हो जाता था, मेरे को समझ में नहीं आता था मैं क्या करूं।
कुछ भी करके उसको मेरे को बचाना था, घबराहट भी हो रही थी, मगर मेरे हस्बैंड को बाहर तो मेरे को लाना।
When he was in the hospital, he crashed many times. We explained the relatives, if we don't do anything, he has weeks or months left in his life. If you give me this consent, we can proceed.
Like my hands were shaking while signing that. I was so much nervous and I cried inside to some extent.
He was lost in follow-up in last few years. Aortic stenosis from moderate to became severe in 2 years' time. Extremely bad. He presented with florid left ventricular failure and almost cardiogenic shock remained.
At that point, I understood the actual, criticality and deep down understanding that my father might not come out of that room alive.
After all the struggles and setbacks, he fought his way back from the brink, turning a fatal situation into a story of survival and triumph.
24 hours prior to the case, we were all discussing about what all things can go wrong. I thought of discussing about the case, the clinical background and the CT scan analysis with my mentor, Dr. Abdul Rashid. He said, if you don't do it, he is going to die. You proceed, implant a new valve and do your best.
Heart has valves which ensures that the blood flows in one particular direction across the heart. We have 4 heart valves. Now, the most common valve affected by diseases in a geriatric population is aortic valve, and mainly it is degeneration leading to the stenosis, meaning that the aortic valve gets stenosed and it's called as aortic stenosis.
Usually it begins with climbing stairs, then it progresses to walking on straight surface, and in the end stage, like the patients that we had, they had symptoms at rest even while lying down. We took him to the cath lab, we started the procedure. Everybody was nervous. We didn't know how his heart will respond, how the 8 to 10% ejection fraction failed heart will respond to this therapy. Usually we do such procedures in conscious sedation or just local anesthesia, but in his case, he was so breathless when he lied flat that it was not possible to do it that way. So we had to intubate him and do the entire procedure in general anesthesia.
Rather than cutting the chest, giving anesthesia, putting the patient on heart-lung machine and doing all this is by and large, most of the time it is done in local anesthesia by giving local anesthesia in the groin, right and left groin, even local anesthesia, and one of the groin, we put the tube, that is the sheath, and through that, we go inside. First, we will assess everything. Initial assessment is done by doing regular investigations, including all those regular investigations, ECG, echocardiography, and then CT scan, and then the premenstrual assessment. And on the basis of that, the suitability is decided. And after that, when patient comes on the table, we have our plan ready. In many of the patients, we dilate the valve with the balloon so that when we go in with the TAVR valve, it is easy to place it properly. Placement and everything is done in different angles, and then the valve is inflated with the balloon. There are self-expanding TAVR valves. They are also available. Depending on the suitability, you can use it. The learning curve is much shorter with the balloon expandable TAVR valve. And recently we have started this program and we are extremely happy with my valve, which is a balloon expandable valve. But as a center of excellence, once we develop, we are going to use both the type of technology depending on the severity of the patient's valve. Thank you.
Whenever we implant the valve through femoral route by intervention, the old valve is crushed against the newly implanted valve and it will not cause any obstruction.
As soon as the pre-dilatation was done, implanted the valve in next 5 or 7 minutes. The most nervous part is the shoot that we take after valve implantation to rule out annular rupture and paravalvular leak. We saw the valve functioning well, but the patient was intubated on ventilator and was sedated. So the last thing that we have to check after the procedure ends is a stroke. And we waited for 30-45 minutes till he woke up. Then I checked his power and function of his limbs. He was able to respond to my vocal commands. So we ruled out any major stroke.
We were very happy to see the patient's improvement happening so rapidly.
Oh, that is like the happiest feeling I would say in the world as of now. Because when I saw my father came out of and he was able to breathe, he was able to talk, I was getting happier and happier and happier because the recovery was fast.
टावर होने के बाद दूसरे दिन मेरे को लगा कि कुछ प्रॉब्लम नहीं है बॉडी में, मैं खड़ा भी हो सकता हूँ, चल भी सकता हूँ और मैं काम भी कर सकता हूँ, ऐसा लगने लगा। इतना फील कर रहा हूँ मैं 25 साल का हूँ, जैसे काम करूँ ऐसे काम कर सकता हूँ।
So I would genuinely like to thank you, Dr. Tejas Patel, Dr. Aman, the whole team. They are like the pioneers in that field, right? So there was no doubt about the surgeries. But along with that, I would say support and other things that we got from the staff was amazing. And thank you to the whole staff at the Apex Hospital and thank you to the Apex Hospital.